up?
How's the kerfuffle? How's the kerfuffle? Hello and welcome to the live, everyone. Thanks so much for jumping on with Jess and Jane. We're super excited to be here. Now, do you guys want to start by introducing yourself and what you do? Jane, you can go first.
My name's Jane. I am a neonatal nurse practitioner who works currently at our local hospital and also Coastlife. My name is Jess. I have been a nurse practitioner after doing my training in London
12 years.
now. But a neonatal nurse before that, total for over 20 years.
Amazing. So you did your training over in London?
My nurse practitioner training.
Ah, are you Australian? Are you born in
Yes.
Australia? Ah, cool. And you just travelled over there and did that
Hanging
thing?
out there for a while. Didn't decide whether to come home. Decided to get a real job instead.
Nice. Very cool. That's amazing. How fun.
It was fun.
Yeah.
That's good.
And when did you move back here? How long ago?
In 2013, so nearly 10 years now.
10 years. And you started at, well, probably Nambour back then, I guess.
No, I was in Melbourne. So I went to a children's hospital in Melbourne.
Cool.
And then came up and the school opened up here.
Cool.
Yeah, so never worked in Nambour.
Yes. Oh, unlucky you. Unlucky you. So then you started at Coastlife how long ago? Because that's somewhat new, I guess.
I think it's new. Doing two jobs, I guess. I started 6 months ago. So
Yeah,
in
cool.
October.
Amazing. Amazing. Oh, great. Awesome. And what about you, Jess?
So I am a child health nurse and a lactation consultant. So I've been a child health nurse for about 10 years. Prior to that, paediatric nurse.
Cool.
So worked at Royal Children's in Melbourne and the Marta Kids in Brisbane and Royal Children's in Sydney.
Awesome.
And yeah, then came back to the coast, which is where I'm from, and did my child health.
Mm-hmm.
And then I've been a lactation consultant for, I would say, like 6 years. Yeah. So
Awesome.
have been working with babies and families for a very long time.
Did you stay being a pediatric nurse while you were doing your lactation outside, or how did that go down?
So did my child health first,
Yeah.
and then did my lactation, sat the
Cool.
lactation exam. So it's just an international exam that you have to sit
Yeah.
and pass. And well, you have to be accredited to kind of be eligible to sit the exam, and then
Amazing, amazing. Okay, cool. Well, we have a bunch of questions from our mamas for you guys today, and I am super excited to get them answered for them. So, okay, I want to start with this one because I'm curious on the answer. So, Jess, I feel like I'm on a talk show or something with different questions on the timer. Okay, so one of our mamas wrote in, how soon would you introduce a bottle of pumped breast milk? Hopefully we can boob and bottle this time with her second babe. I breastfed my first baby till 14 months and struggled to get her from boob to bottle. Used to have to go into daycare and feed, then run out, come back a few hours later, which just sounds wild. I think we introduced the bottle too late. What are your thoughts?
So my first thought is I think it's always interesting how even though when we have a baby and we birth an individual, mums are very good at blaming themselves. So it's really interesting in this question how automatically the mum's like, I think we introduced it too late, like it's her fault. And unfortunately when we have an individual, there's not a lot of control that we have over certain things, and some babies are just booby babies. And you know, I've had circumstances in which, you know, I've supported families to introduce a bottle at, you know, 8, 10 weeks, and then the baby turns 4 months, mom wants to go back and needs to go back to work at 5 months, and then the baby goes, no thank you, and you know,
To the bottle.
we have to the bottle, and we have to sort of rejig things and start all over again.
Mm-hmm.
So I think that in the early days, those first sort of 8 to 10 weeks, expressing and trying to introduce a bottle is just another step, and it can be really tricky because your milk supply is still evening out. You're still in the initiation phase, and babies just want to be fed. So I certainly wouldn't do it that early if it could be avoided.
Yeah.
In those first 6 to 8 weeks.
Yeah.
If that can be avoided, I would not be pumping and trying to give a bottle then. But then I'd be trying to get some support after that point.
Amazing.
This is what we want to do. This is when I need to go back to work. This is our goal. Because, when we are exclusively breastfeeding a baby, it is demand and supply.
Mm-hmm.
And then if we throw some expressing in there, I want to pump, that alters the demand.
Mm.
The supply can be affected, all those kinds of things. So I think that there is no one-size-fits-all answer to that question.
Mm-hmm.
But I certainly wouldn't be doing it in those first 6 to 8 weeks if it can be avoided.
I love that.
I'd be getting some support.
Yeah.
For sure.
Yeah. I actually say the same for dummies. What do you think about that?
Well, again, there's some really hard and fast rules out there that you can be like, don't introduce a dummy before 6 to 8 weeks.
Mm.
But again, when there are some individual babies, and I'm sure we've all worked with them, who just want to suck, and that's the only way they will soothe.
Mm-hmm.
And
they're not even hungry. They're just wanting to suck.
exactly.
Yeah.
And then we have those babies that suck, and then their tummies get really full, and then they're cranky. And, So again, I think that if you're feeling like I need to introduce a dummy, I need to have a period of time where I can put this baby down.
Mm-hmm.
I would just seek some support.
Yeah.
And recognize that, like in the States, they call it a pacifier.
Mm-hmm.
And that's what it is. It's to get you through these chunks of time where babies just want to continue to suck. And it's not going to be as helpful. So yeah, I think there's no hard and fast rule. Again, if you can avoid it in those early weeks, that's great.
Yeah.
But, sometimes you've just got to put the baby down.
Yeah, yeah. So if you notice in the first couple of weeks that you've got one of these types of babies, you can potentially introduce it early and seek support, as you said.
Yeah. Absolutely.
Awesome.
Absolutely.
Can I just say something?
Absolutely.
I quote Jess all the time. So I've heard her say to families before that we really need to remind ourselves that babies actually have a physiological need to be with us for a period of time after their birth. And Jess describes it as just as physiological as needing a nappy change or being fed. They are meant to be with us, which is obviously as mothers and parents, I guess, but which is often a disconnect to how we live in a society these days about we like our own time and we're used to being independent and all those kind of things. So Jess is very good at reminding people and supporting them through the adjustment.
Absolutely. Yeah, that's actually such an interesting perspective. Yeah, because back in the day, there was no way we're as independent and alone as we are at the moment. Like, you would have your families, you would have your partner's family, and all the grandkids, etc., in the one house. So you would never be home alone. Whereas so many of us are home alone now and in the cars alone. And even if you're both at home in different rooms, just on your screen or whatever it is. So yeah, when you all of a sudden have this baby attached to you, it's a huge adjustment, isn't it? Yeah.
Well, a lot of people really struggle with it at first.
Yeah.
Massive adjustment, yeah.
Interesting. Let's tangent on that for a second. So how would that look if a woman would she essentially come in for an appointment with you for normal baby stuff, and then you discuss with her how she's going with the adjustment, and how do you sort of support her through that?
Yeah, so I mean, as Jane said, that's something that we always touch on. Like we always say with our service, there is no such thing as a baby. There's a baby, and whether it's mum, dad, extended family, there is no such thing as just making an assessment of the baby, because we need to see how the baby is fitting into and what the adjustment of the entire family is like. And oftentimes when mums come to see us, it's that normalizing of, you feel tapped out, you feel like you want some time without this little person that you love to the bottom of your heart, but you just need to go to the toilet or have a shower or have a period of time where you don't have them attached to you. And sometimes I think for us it's just normalizing that, going, yeah, you know, we get it. Your needs and their needs are at the opposite ends of the spectrum in terms of touch or wanting to be attached sometimes.
Yeah.
So yeah, part of that is just normalizing it and reassuring them that that's okay. And then, as Jane said, normalizing, you know, infant behaviour. And I think, you know, sometimes as mums we want to know that we're doing a good job, and so people are like, oh, are they breastfeeding again? You know, people will say that to mothers. Oh, they're on the breast again. Oh, you're feeding again. Oh, you're not going to put them down. Oh,
Honestly, people's unsolicited crap just comes out of nowhere. Hey, I'm just like,
Including family members.
yeah. It's amazing how much they just like, out of nowhere, will just say this stuff and not even contemplate how it would affect mum or bub or...
Absolutely.
Yeah, it's wild.
yeah.
Yeah, okay.
So, you know, kind of taking that and normalising, as Jane said, that the infant, you know, little babies are physiologically designed to be connected with someone.
Mm-hmm.
And that's really challenging as an adult, but it's extremely normal. And so finding a way through that. Where are those moments where you can ask for help? Where are those moments that you can take the time to fill your cup a little bit? And kind of navigating that.
Yeah. Mums and Bubs yoga. Woo!
Yeah. Absolutely.
That's so interesting. Yeah, love that. Love that. Okay, cool. So a common problem you were saying that you get in your guys' clinic is the whole mottled skin question and also the grunty and congestion. Do you want to speak to those topics at all? Because I'm sure there's lots of mums out there being like, what the heck's going on? Is this normal?
Yeah. As we know, babies often can things.
Yes. Yeah.
Unpredictable, a bit weird.
Yeah.
Change tomorrow compared to what we were doing today.
Yeah.
So modelled, I saw a very modelled looking baby today. So as part of obviously us making an overall assessment, I guess, is a physical examination. So things I'm worried about, obviously we hear about blue babies or cyanose babies and that it rings alarm bells with most people. I guess modelled, it just a reminder that that's different essentially. So we like generally our babies to look a bit pink, but as we've already kind of alluded to, every baby's different. So this baby today, for example, I check their heart, make sure they are circulating their blood around their body properly, as we would expect. So looking at lots of different things. So even though there's an overall mottled appearance, the perfusion was okay. So that sends messages to me that the baby's still sending oxygen to where it should be in its body, essentially. It was a bit cool, sometimes they can be a little bit more mottled looking when they're cool, but it's just, often they're just complexion and they will just grow out of it. Sometimes it can be a bit gravity dependent as well, because sometimes, if we're breastfeeding or holding a baby, then we might have trapped a leg somewhere, so that leg can come out looking very purple or something like that, but that's just a circulation thing and it'll just sorts itself out eventually. So,
amazing.
So in the absence of anything more sinister going on in an otherwise well-looked baby, mottled can be very normal.
Yeah. And mottled, like, is it too hard to describe what that is for people who don't know? Google it.
Or describe it today. Patchy looking. She
Yeah.
said. Patchy looking.
Patchy. I would even almost sometimes say it's like a grid underneath the surface of the skin of like purple
tiles.
grid. Tiles. Yeah. All different shapes and sizes.
Yeah.
And
yeah.
Okay, cool.
Different different colours.
Yeah.
Inconsistency of colour.
Yeah.
Yeah.
I would agree. So, correct me if I'm wrong, mottled skin can be an indication of poor circulation, but definitely not always. So, if your baby's got mottled skin, it's definitely worth coming into people like you guys and getting a checkup, but it's quite probably nothing too sinister.
Yeah. And I guess on that note, just thinking about the signs and symptoms of an unwell newborn,
Go for it.
Mottled can definitely be one of them, obviously, in conjunction with lots of other things. So as parents, we will know what's normal for our baby because they're all different, even from their siblings. So their colour's different, their tone's different, their activity's different, and that obviously varies with their age as well. So whatever's not normal for your baby is probably ringing alarm bells. So if they're a bit more sleepy than usual, a bit more irritable, which they can't be consoled, they're not sleeping, not feeding, sorry, their wheeze and poos are less than they are normal, they're a bit floppy, you know, lots of different things which is just abnormal for your baby essentially, which, you know, people would rather, especially health professionals would rather, you're never going to be criticised for bringing your baby in to be assessed
100%.
than the opposite, than potentially leaving it too late, because they can get as unwell as quick as they can get better. So it's worth just someone taking a look essentially. If you're worried about anything, number one rule we've all been told along the way is listen to the parent. They might not know what's going on, but they can 100% tell you it's not normal for their baby.
Yeah. So often they say these tiny little symptoms and then they often end up saying it's just different. I just know that something's off. I just know that something's off. And you're so right. It's like a pregnant woman. We always say that. Like if you just feel off, everything could seem super normal. But if you just feel off, 100% come on in, hey, because that's the
And you'd
best
rather it
indicator.
be okay and then be completely fine and you're like, what the heck was that?
Yeah.
And then we'll never know and go on your merry way.
It's so funny sometimes with medicine. Like I think, like it can obviously medicine can come across very formal and very intelligent. However, half the time we're just fucking playing by ear and just seeing what the heck's going on. Like no idea. Just try some things and see if it works.
Eliminating the big stuff.
Yeah, eliminating the big stuff. It's like a process of elimination rather than just seeing a baby and being like, that's that. And this is something that I see often, and honestly, especially in the nursery, as you were saying, you work in the nursery a lot, and like sometimes babies will come over and they might have a temp, or they might be not feeding that well, but their blood cultures are normal and everything else seems normal, and we just don't know what's going on, and they're just there for observation. And you can really see it in the parents where they're kind of like, what do you mean you can't tell us what the problem is? And it's like, I think that's something that I often will explain to them, because they kind of feel like, you know, maybe you're hiding something, and I know that you guys always explain like exactly what you think the potentials are, and I like often find myself explaining to them, honestly, we don't know what's actually going on right now. Nothing's being hidden behind closed doors. We're not sus on anything and not telling you. It is simply the fact that we're not quite sure, and we're just continuing to observe to see if it magically fixes itself and all is well, or something else happens to indicate what's actually wrong.
Better be safe than sorry.
Exactly. Yeah. Exactly.
And I think, Amy, on that note, if you have the opportunity to see someone like Jane, like we were saying earlier, you know, there are very few people as skilled at assessing a baby, you know, to make that really good, thorough assessment and say, yeah, these things might be a little bit different, but overall we know your baby's fine and healthy.
Absolutely.
You know, and then as a parent, you can have that peace of mind.
Absolutely. Even when I came in the other day to Coastlife Families, and you had said something that you were seeing a baby with a floppy larynx. Like, I don't know anybody else on the coast, external from the hospital, that someone could go and feel confident that their baby's getting the best care. Like, I don't even know, like, there's no way you could, nothing ever against GPs, but there's no way you'd feel confident going to a GP over your baby having a floppy larynx, which essentially is a floppy airway for peeps at home. But yeah, like, that's such a cool service to have available for everyone, but especially for people with more complex needs. Yeah.
We're just lucky we have availability and time.
I go to Jane, be like, yeah, I'm fab.
As we've said, it's so difficult to get into GPs these days,
Yeah.
let alone a paediatrician.
Yeah, absolutely, absolutely. We did segue into my mind somewhere else before, but now we've gone well past it and I've forgotten. So,
Mottled was one question.
Oh, grunting.
yes, thank you. The grunty and congestion. Mamas often come in with that, and they always tell me about it too. The baby's grunting throughout the night. They're like, "Is it feeding? Does it need a feed? I don't know."
Yeah.
I'd often wake the baby up to feed it. So, what are your thoughts on that?
Yeah, that's right. Well, I experienced it myself, so I totally get it.
Yes.
Totally get it. So there's obviously periods, but usually when babies are asleep, that you know, we have families coming all the time going, "What the heck is the noise that they're making all the time? Is there something wrong?" They're thinking the baby is potentially has an airway obstruction, things like that. But generally speaking, it's just they're just not in necessarily a deep sleep. So yeah, you're looking at them going, why are they making a noise? Are they going to the toilet? Are they having a poo? Are they weeing? Are they going to vomit? Are they hungry? Are they actually asleep? my advice is that they just make funny noises all the time, and if they look otherwise well, go back to sleep, because they'll certainly wake you up when and if they want to feed.
So true. And it's so hard because, like, everyone has that. Like, say if even your partner has a bit of a time where they're stirring and they roll over, but you wouldn't even wake up, right? Whereas as a mum, and you've got your mama instincts going on, and you're on edge, and you're always waking up to every little noise. Yeah, so true.
It will get better. You get used to the noises.
Yeah,
and then,
amazing.
And then you're more confident. You know, you become more confident, and you're going to back yourself that you will wake up to your baby, who is when they're hungry, essentially.
Yeah.
Try and get as much as possible.
Absolutely, yeah. If you wake up and they're just grunting, they're not crying, they're not awake, just leave them. Go back
And
to
snuffly that people talk about a lot. So that kind of snoring sound coming from the upper airway. It's just because their airways are so narrow, especially if you've got a spilly baby. Sometimes, you know, when we've all vomited in the past, it goes up through your mouth and into the back of your nose. So sometimes you can imagine such a small airway, if there's any kind of obstruction, whether it just be normal mucus, remembering that our airways are a filtered, humidified passage into our bodies. It's meant to be moist and have mucus in it. So that kind of occlusion or just a bit of milk that they've brought up can sound louder than it actually is, if you know what I mean. Because even a partial obstruction on a small airway can make it sound very noisy.
Yeah.
And most of the time when I listen to chest and, you know, the history of a baby having those issues, the chest is crystal clear. It's not to do with their airways. They're breathing, you know, airways at all. So there's nothing wrong in their lungs at all. It's all coming from here, and there's no problem. And if it's not interfering with feeding at all, because we obviously completely seal their mouth when they're particularly breastfeeding, if they can still feed adequately whilst the sealed mouth, their nose is obviously clear.
Yeah.
So that's reassuring.
Absolutely. Yeah, I agree completely. And quite often, it's amazing how much they can actually breathe, even though it looks like their nose is completely occluded. Like on the breast, like the breast is spilling over, especially when they're newborn. Sometimes it's like you just put them on and you just wait and see if they pull off or not, because it looks occluded, but then they just make do. So it's quite funny, isn't it? Okay, so we had another question come in. What are the early signs of mastitis?
So, mastitis is...
I made that into such a big deal when I said the question with such simple words.
Wait.
Should I talk? I don't know why. I was really processing that, but it was the simplest question. Go on.
Well, it's got a big answer.
That's true. That's true.
So mastitis is an infection in the breast when we're breastfeeding.
Right.
So, and this can happen particularly in the early days when your milk first comes in and you're very engorged and you've got, you know, nice round full breasts, and you've got a newborn who's maybe not drinking so much because they're little and they're having short feeds. And so what we're looking for, and when a woman gets mastitis, they can become quite unwell. So it's flu-like symptoms as well. So what we're looking for is any lumps in the breast, particularly after a feed. If the breast doesn't feel nice and soft and there's any lumps, you know, particularly around these outer edges, it's quite common. And if those lumps get tender and then progress to being tender and red, and then that redness can then often sort of come before then these flu-like symptoms. And so then it's progressed into mastitis. And oftentimes when you get to the stage as a mum, as a breastfeeding woman, when you feel these kind of systemic flu-like symptoms of just feeling, you know, feverish and tired and sore and achy, then that's when you will potentially need antibiotics to clear that up. So the early signs would be these lumps, particularly after a feed.
And essentially, like, if you were to feel a lump after a feed, to try to mitigate the risk of needing antibiotics, what would you do?
So it's particularly, you know, if it's a short feed, or like I said, when if your milk has just come in and you're quite full and your baby's not taking big feeds, then you may still feel some fullness after. So what you can do is, particularly if they're, you know, people talk about breast massage, what we need to remember is the ducts. The milk ducts are quite close to the skin. We don't need to get in there.
Interesting.
It's not like a...
It's not like the deeper the better.
Yeah, no. It's because if you get in there, what you can do is actually do some damage to the ducts, and then you can get some, then you're actually putting yourself further at risk of mastitis.
Interesting.
So after a feed, if you feel like, oh, baby didn't take very much, I'm still quite full, then you can do some gentle massage and maybe some hand expression to try and relieve that fullness a little bit. And then after you've done that, you can use a cold pack. Because again, when you put cold on something, like when you've hurt a muscle, it reduces the inflammation. So there has just been, in the last 6 months, some new guidelines about management of mastitis, and much more those guidelines are focused on cold. So putting cold on these inflamed areas of the breast to try and reduce that inflammation, and then just continue to feed. And again, if you feel like you've got a little bit of a mismatch, because particularly when you first give birth and you deliver the placenta and the milk first comes in, your body is just making as much milk as it can. So we can have a little, some women experience oversupply. So if you're worried about that, I would definitely seek some support, because again, you don't want to express on a pump, which increases the demand, which your body will then increase the supply, which you're in that cycle of trouble. So yeah, early signs, lumps, particularly after feeding, and if you can do some gentle massage and hand expressing to try and relieve that fullness, and then cold packs.
Interesting, because am I right in saying that cold packs used to be a thing and then they were taken out thinking that the constriction is going to make it worse?
Yes.
So that's really interesting that it's back in.
Yeah, so those recent guidelines have come out and said,
Cool.
yes, cold packs. If prior to a feed, I wouldn't use a cold pack because,
Yes.
like you said, constricts,
Yeah.
which means that you're not going to have the letdowns and the milk flowing.
Yeah.
But yes, after a feed, if you've still got lumps and you're getting this kind of inflammation, cold packs.
Interesting.
Does that make sense?
Yeah, absolutely. And after a good hand express as well.
Yeah.
And I'll add on there, agree if you do, that maybe with that hand express, use either a heat pack or even in the hot shower to help
Yeah.
express a little
Yeah.
bit of that
Absolutely.
out with hand, and then followed by a cold pack.
Yeah.
Oh, great. I'm glad to know that that's changed, actually. That's really great.
Mm-hmm.
Okay, cool. Let's talk about a pretty controversial topic of tongue and lip ties. I actually had a mama the other day who was talking about the fact that she had lip ties cut, and obviously I didn't necessarily speak to it at the time because it was already done, but it's so common. Yeah. Anyways, tell us your thought. And remember, this is a podcast. This is just your opinion. It's nothing's like going to be, yeah.
Well, I think it's generally agreed that there's not a lot of evidence about it, but what we do know is that anecdotally, so particularly women who are breastfeeding, report that if they have had a tongue tie release on the baby, then it's not so painful. So obviously, certainly in the hospital, so tongue ties are performed, tongue tie releases, I should say, are performed in the hospital by myself and some other practitioners there after an assessment, a proper assessment, obviously, by the lactation consultant. And I guess concerns moving forward are obviously feeding concerns and speech issues further down the line, which are obviously very hard to predict in the newborn period. So certainly we come across families who have a family history of tongue ties and may have had traumatic experience with a past baby or themselves. We recently had a dad come in who's just got his tongue tie himself cut as a grown man at a dentist not very long ago. And I had a mum just on the weekend in the hospital actually who was diagnosed with a tongue tie by her dentist recently.
Wow.
And her partner just gave her a bit of stick for not being able to stick her tongue out very far, but she never really thought about it before. And her baby has a significant tongue tie, so she was, although it wasn't interfering with feeding, she in particular wanted that released for the baby's benefit. So obviously everybody's different. So we're obviously talking about the frenulum, which connects the tongue to our base of our mouth, which is obviously where it should be, and having that tongue there is obviously has a lot to do with certainly embryological, so when the baby's growing growing inside us, the formation of the mouth is dependent on that tongue position essentially, and affects the development of our hard palate and even the shape of our mouth and our jaws and things like that. So it needs to be there. There's varying severities obviously, so I guess the message is really thorough assessments by lactation consultants essentially.
Lactation consultant.
Majority of people, I guess, releasing ties in the community are probably dentists.
Yeah.
At this point in time, so certainly you won't come across any neonatologist, paediatrician, nurse practitioner who will be cutting anything other than a tongue tie. But other professionals do.
It's fascinating, isn't it? It's such a fascinating topic. So, quick question, but we're going to continue on that, is what would the benefit of an adult getting a tongue tie snipped be?
That's a good question.
Thank you.
His dad just wants a tongue tie.
So the next 6 months he'll get his snip done, and then
what is it?
He had 6 weeks
Six weeks of work.
oh my gosh.
I think pretty much if you survived your entire adulthood and being able to whistle and lick ice creams, you're doing okay.
Yeah. Yeah. Okay, so he could. I was thinking maybe speech-wise, but no.
There's no issues with speech.
Wow. And the woman was the same. The
No,
mother,
so
you
we
said?
saw this mum.
Yeah.
Nothing. She just said, her husband just noticed she couldn't stick her tongue out very far. That was
Oh my gosh.
that was the
Isn't that funny? Like the thought of getting that cut is like ick. So it's definitely not a
So
easy
is
comment.
it? It is a relatively depends on who does it actually.
Yeah,
But
right.
if it's significant and easily done in the newborn period in the hospital, as I said, we would do it if it's affecting feeding, definitely. And generally the babies tolerate it really well, actually, because there's no pain receptors in the frenulum, so it's easy to do that for them. It is. And historically, there used to be midwives with very long, the pinky fingers that, their nails on their pinky finger who used to do it. So I guess
That for the first time the other day, I was like, that is wild.
through history, we've been doing it all along anyway.
Yes. Okay, so tongue ties we would snip as a neonate if it's affecting their feeding, right? But if it's not affecting their feeding, then you usually
Generally
don't
not.
worry about it.
There's obviously a lot that goes into the assessment because it's about the movement and lift and extension of the tongue and things like that. So if it, like, all the, because we obviously do it in our clinic, we definitely see a difference.
Oh,
usually,
amazing.
But I guess people don't come to us unless there is a genuine problem kind of thing. Because nobody obviously wants to put their baby through a procedure unnecessarily.
Yeah. So you guys cut tongue ties at the clinics. Now, why don't you cut lip ties, and what are lip ties? How do they work? Are they legit? What would you recommend if someone's been recommended a lip tie?
I'll go back a bit. So we do cut tongue ties, but the way in which we do it, the only way that, there is an appointment with me, a full lactation appointment with me.
Because often after that appointment, they're deemed to be not necessarily anyway, and the families are happy with that. So that's the point of that original appointment, just because they've come to us in desperation, which is often not the case, because feeding hasn't been as ideal as hoped. So often just an appointment with Jess and some feeding support is enough to alleviate their dramas.
Totally. And as you say, why get it done if you don't need to? If it's not going to help. Yeah.
Exactly. And so, and because, we always, and if we do decide if the recommendation from us is and the parents are in agreement, we do decide to do the procedure, then still there is a follow-up appointment a week later to make sure that, then the other strategies we put in place around feeding are successful as well, because it's not a magic wand.
I think that's what people need to be reminded about, that unfortunately it's, as Jess says, not a magic wand for everybody. It's not going to, people often hopes on this is going to be the be all and end all and sort everything out. But often, even if it is a successful release and it's an obvious restriction, it's not just a instant fix. It needs to be more work put into the process as well.
Absolutely, yeah, so true. I think that's good to know because you're right, people do hang on to that. As soon as this tongue tie's cut, feeding's going to be easy and everything's going to be fine and my nipples aren't going to be sore. And
Absolutely.
yeah.
Yeah.
Going back to your lip tie.
Yes, thank you.
We wouldn't do it.
No,
No.
because the evidence doesn't support that it's helpful.
No, that's right. So obviously there are other people that do it, and anecdotally, definitely have families that come in and have raved about it.
Okay, interesting to know.
I think it's just a more extensive procedure, I guess, and certainly not performed at the hospital.
Yeah, yeah. And essentially the ties, that's like under the top lip, under the bottom lip.
Yeah.
And then I've heard of these cheek ties as well. But buckle ties. Yeah. So you guys feel like they're not supported by evidence to get any of those done. So if someone was, I guess having a lot of difficulty with breastfeeding and they've heard about these lip and cheek ties, like what would you recommend that they do if they're like don't know what to do? See a lactation consultant, 100%. Yeah, I agree completely.
Yeah.
I agree completely. Thanks so much for answering that question because I feel like there's so much.
It is
unknown
very
about it.
quite fashionable.
Yeah.
Yes, yeah, I would agree.
And people are desperate. Like, you just want to do the best by your child.
Yeah.
So it's very tricky when a health professional is telling you that this is what the recommendation is. You're generally going to follow that because you're in trust of them. And I think, regardless, generally speaking, every health professional means well.
Yeah.
They're just practicing on their experience, I guess, and opinion, perhaps. And certainly if someone came to us, like you said, after the fact, then I'm certainly not going to slag off their decision. We carry enough guilt around as parents. You're not going to, increase theirs by, making them feel that they've made a bad decision.
Yeah, I totally back that too. I totally back that. Yeah, let's go to that. Okay, so this is another question from a mama today at Pilates where she said, my baby's 4 months old and he started having very stinky gas but normal poos. Also now only poos once a week. What's happening there? Is that normal?
So for an exclusively breastfed baby, yes, essentially. It is 7 to 10 days is still considered to be normal period between doing the poo. As long as baby's feeding well, there's no increase in vomiting, still passing wind, and when the baby does do a poo, the poo is soft and moist. The reason that this happens is, everyone's gut is different, as we keep raving on about. Every baby is different. We're all individuals. So some babies, yes, will start to poo less and less simply because, the way their digestive system works, and there's not a lot of waste products with breast milk. So pretty much everything in breast milk can be used, either as hydration or, immune support or calories or whatever it is. So there's just not a lot of waste products with breast milk. And so the way that some babies process that is they just poo, after sort of 6 weeks, they just poo less and less and less. And obviously the longer that sits in the tummy, the smellier the farts get.
Yeah.
So as long as the poo looks normal,
Yeah.
that's fine.
Amazing. Interesting. So what is the difference? I'm imagining it's just the gut maturing. That's the difference of like a newborn who poos 10 times a day to slowing down. It's so interesting. I remember when I found that out, I'd been a midwife for like 2 or 3 years, and one of my neighbours told me that their kid only poos once a week, and I was like, dude, I think you need to get that checked out. She's getting enough food. And he was like, yeah, it's super normal. So that's interesting. It's just such a lack of waste product because breast milk is so pure.
Yeah.
Amazing.
Yeah.
Isn't that just
Absolutely.
amazing?
So yeah, as long as all those other things look normal, still putting on weight, still feeding well, no
Love that.
increasing vomiting, not particularly painful in the gut, passing wind, soft, moist poos, you're golden.
All good.
Yeah.
Amazing.
Gaining weight.
Gaining weight. Yeah, that's a good one. That's a good one. Yeah. This babe today that had this issue is particularly beautifully chubby, so definitely not an issue. Okay, let's speak to the cold and sweaty feet, because lots of my mamas say that babies have cold feet and they always put socks on them. Is this normal? Is it bad circulation or is it normal circulation? What's your thoughts on that?
I think that, like most things in babies, everything's just a bit immature.
Yes.
So it's just essentially sorting themselves up, especially when babies are growing inside mums. They're doing a lot of that processing and regulation and things like that for, as you can imagine, for lots and lots and lots of different systems in the body. So I think it's just one of those dysregulation things that they're just sorting out. So that it's just lacking maturity essentially at this point in time. So again, like we said about the modelling, in the absence of the baby being unwell in any way, it is completely normal. And remember, we have sweat glands everywhere.
Everywhere, yeah,
everywhere.
That's so right.
That's just the same as the feet, essentially.
Yeah. So just chuck some socks on and love that. Okay, cool. I reckon I want to ask to you, what would be the reason to come see you guys? Why do people come see you guys?
You go first.
And you both have very
the
different.
fact that you're awesome, which is reason enough.
Absolutely. And you both do very different roles, so you can answer to you and then
very different roles. I guess the difference, because I guess you can go anywhere, not anywhere. You can go other places to get our services. In that we perform, like we've said, growth and development checks. I guess we do procedures like tongue ties, blood collecting, things like that. We do referrals. We do vaccinations. So obviously people know that they can get most of those things in other places in the community. But I guess the point of difference of us is specialty. We're not necessarily, and again, no disrespect to GPs, but as I said before, it's in the title, isn't it? They're general practitioners, and we're specialists, and my specialty is babies, I guess, and over 20 years experience there. But fortunate enough to have still a long connection with the hospital and working in an acute setting, and access to neonatologists and paediatricians and things like that as well. But also bringing that experience into the community, which has been really nice to get back and work with families and see lots of babies. Remind me that not everybody's unwell. Babies aren't unwell.
So true.
So specialty, I guess, and time. I keep saying time. We, as you know, we have a beautiful, and people who've come to see you know about our beautiful space. So we're different in that we don't have sterile waiting rooms and things like that, and that's the point. There's no waiting, essentially. And as I say, time is, we offer hour-long appointments as opposed to,
so good.
we have that luxury, whereas other, obviously, practitioners don't have that luxury. So, I guess that's where Jess comes in as well, because we have time, and it's about being family-centred as well, and that's what Jess does.
Jess,
I mean, I always say to people, and I said this, my best friend's little sister had a baby recently on the coast, and I was like, if nothing else, please get your baby checked by Jane.
Yes.
I just think to have access to someone with such skill and such knowledge and such experience, it just, as a parent, it gives you peace of mind. My baby is well. We're starting off this journey with a well, healthy baby, and I can feel really confident in that. So, and like Jane said, we have the time. So our appointments we always offer an hour. As a child health nurse, our specialty is sort of mostly 0 to 5. We do some work in the sort of teenage space when more things happen. But generally for me, I work with families, with kids 0 to 5. So that's what is normal, optimal, expected growth and development of these individual babies. So for us, because we have the privilege of seeing these families on, a lot of our families, they come to us for a year. and we see them for all of their growth and development checks for that year. So you have the privilege of knowing these children, these little people as individuals, and helping, the family see the wood for the trees. Well, remember, they're worried about a certain aspect of development, but you can remind them how brilliantly their baby is doing in another aspect of development. And, and again, if there are any concerns with growth and development, then we can observe it early and put in some strategies in place, whether it be play strategies or whether you do need to go and see another health practitioner to try and, nip those things in the bud early. Because we know with little people, if there are concerns with growth and development, early intervention is absolutely vital. Where should we be in terms of the growth and development? We're not quite there yet. What can we do to help support that?
Absolutely.
It's an absolute joy for us to see these little people grow and come back from being held, babes in arms to come in, and then, it seems like a blink of the eye, the mum's walking in and the baby's walking in. Or are they walking in next to them? And, so for me as a child health nurse, I get to talk about all the really exciting and wonderful newborn stuff, but then we also get to talk about, what happens at 4 months around development? What happens at 6 months when we're wanting to introduce solids and baby's starting to teeth? What happens at 10 months when they're starting to move their big muscles more and they're growing and they're wanting to walk? What happens at 12 months when you have this person who is their own little person? And then the toddler years, and then toilet training. We recently had a really, really lovely review from one of our families who was on a package that mum saw us for 12 months with her second child. And she said in the review she wasn't sure sort of how much she was going to get out of it. Because obviously not a first-time mum, but a lot of the appointments we talked about the toddler and the challenges there. And like Jane said, we don't just focus on the individual. It's about how does this fit in with the family? What's the family's values and beliefs? What do we need to work on? And then also, as a parent, our blueprint for parenting is the way that we were parented. And everyone does their best, but oftentimes we come into parenting with, I don't want to do that. That was one thing that my parents did that I don't want to do. But if you don't get on the front foot and think, okay, well, I don't want to do that in that situation, what do I want to do? Then it's about having those parenting tools in your toolkit and also reflecting and thinking about what kind of parent do I want to be? How does this sit with me as an individual? And how can I best live my values and beliefs as a parent with this little person? And then as a couple, what does that look like? So that's the awesome stuff that we get to do, as a child health nurse. I get to do all the cool stuff.
That just sounds so fascinating, and I think that's a really valuable part to what you guys offer. That honestly, I've not heard that approach anywhere else ever. I've not heard any mum say that anyone's approached them with that kind of perspective. And I just think, as you say, having the appointments to focus on how is the family dynamic going, how is the family's health, how is that all as a whole, and I think that's really, really valuable, especially with the how do I want to be a parent. I just think I've been doing, I guess, lots of reading and stuff about that lately, and often how we parent is how, as you say, we were parented, and there's things that you might be aware of that you didn't like as a child and you don't want to do. But there's be so much that we're unaware of. How you discipline your child is how you are disciplined, and also how you discipline yourself. Like, it all is so subconscious as well, and as you say, as part of that reflection process as a parent is really great to be able to have someone to talk to about that, because so many people would be so lost. But something else I wanted to add to what you said is another incredibly valuable part to what you guys do is the continuity aspect in regards to the development, because I've had so many mums, and even at the hospital, the other midwives who are obviously very much in this world, you know, their kids may not be like speaking the right words at the right time, or able to make certain sounds, or walking. I'll see some babies walk at 4 months and some babies walk at 9 months, and then it's just like, it's so hard to know, is this something wrong developmentally? or is this just a little bit late and it's no big deal? And because early intervention is so important, I think the mums can feel so like, how the fuck am I supposed to know what to do? Like, am I going to go and spend, you know, hundreds of dollars on all these different therapists when it could be nothing or not? So it's so good to have like a base to go to where you see all their development and you can make the calls of like, yeah, early intervention is necessary for this. Or no, it's fine. Like, this is going to just take a little bit more time. They're doing so well in the intellectual aspect or something. Like, let's just chill for a bit and check in 3 months. Like,
Absolutely.
And all the home tools from you guys that you use, I didn't even realize that you did that as child health nurses to be able to, like allocate some tools at home to help them develop with those certain things.
Yeah, we talked about this in we run a mothers and babies group, and we have different speakers and wonderful people come and do sessions.
I'm doing tomorrow, which is
so
exciting. Yes.
And you know, Jane's done, you know, recognizing illness and all those kinds of things. And we the session last week I did on kind of just a broad development session. We touched a little bit on introducing solids and toilet training and things like that. But one of the things that I'd sort of made up a chart for all of the mums for a guide, which is sort of the first 2 years. And I said, I'm not going to go through each of the developmental milestones. There are a few that we sort of talked about, but I made a column in that which was, you know, moments to be mindful of. So yeah, if baby isn't doing this by this stage, that is a red flag.
Yeah.
You know, yes, it's very normal and developmentally appropriate at 15 months for your baby to be having tantrums. That's completely appropriate.
Yeah.
That's what we want. So just those little, like you say, those moments where it's like, okay, this is a red flag, and even though there's a spectrum of development, this is when we want to see someone.
Absolutely. And that's just, I think that's such a relief for the mamas to take that responsibility off their shoulders, because they often feel like, how am I supposed to know this stuff? And like it can have these detrimental effects, and it's just so nice to have someone to tell you exactly when those red flags are and they're not as well.
Absolutely.
Yeah.
That's the feedback we get all the time is, as you said, the continuity. So obviously Jess isn't seeing, or we aren't seeing those families as a snapshot. Seeing them over time, that keeps coming back to us is really helpful. And as we all know, if we, you know, even if it's grandma giving advice, or an aunt, or the neighbour, or whatever, or the midwife at the hospital, or even you know, whoever, in an emotion-fueled situation where your hormones are flowing and you've had no sleep, you just want your baby to be okay, you're feeling like a bit of a failure, all those kind of things. All this bombarding of information can be actually confusing. Although everybody's quite well-intentioned, it can be really overwhelming. So offering that continuity instead of going to Google or the neighbour, then that's kind of what people appreciate that we offer. And as we talked about before, another, I guess, you know, positive thing that people feed back to us is just being, as we said, it's a beautiful space, it's family friendly, but it's a really non-judgmental environment. We pride ourselves on offering information and evidence-based information, but allowing people to make choices and not being judgmental about that. And obviously the hot topic would be vaccinations, obviously.
Yes.
So we, you know, obviously run a vaccination service, so we obviously support that, but also support choice as well. So provide information, support choice, and offer alternatives as well. We definitely have families that pick and choose the vaccines they actually want to give off the usual schedule. They choose to split them. They also give them at different times. They choose to delay them. So we support all those choices where we can.
That's so good to know. And I think, oh gosh, that's just so nice for the mamas who do want to do that. And man, they receive such a lashback if they choose not to. And obviously you work at the hospital and you have this approach, which is great, but majority of the peeps at the hospital are judgmental AF about the whole vaccine thing. So I think it's just so relieving for people to hear. So relieving for people to hear. So on that note, let's quickly finish up with you talking about if someone was questioning with what to do about vaccines, if I want them or not, how do I figure out my value-based decision on whether I want them or not? What's your advice as to what to do for them to decide?
I think there is obviously a standard place that we recommend people going, and that is from the Australian Immunisation Handbook, because that's obviously where the decisions are made. There's obviously lots of research that goes into those schedules that are created, and they even vary from state to state, and that's depending on the prevalence of certain conditions and things like that. So even, some people might have an issue with that being produced by the government essentially. It does have information on the prevalence of the condition. So not only it talks about the precautions, the potential side effects of each condition, but it also talks about each disease and how it does affect us if we do happen to catch it, and the prevalence, so that people can make informed decisions. So even if they go there and then find information in other sources, all I would say is just make sure they're reputable sources, whatever that information is being provided, that it is actually evidence-based, and just check where the information is coming from.
And that's in the form of like journal articles and not news articles or magazine articles, Facebook posts. Yes, I 100% agree. And I just think this is something, and again, I have literally no opinion on the vaccine thing, but that's something that I remind my mamas all the time in regards to, say, an induction, and I feel like it just popped into my head in regards to the vaccine as well, is that yes, it's important to consider what are the risks and the potential side effects of receiving the vaccine, what are the risks and potential side effects of not receiving the vaccine and catching the disease, because it's important to consider both sides. And I find with an induction in the hospital setting, it's very much discussed what's the risk of not having the induction and having the big baby that's not induced, or going over 41 weeks or whatever it is. But then there's little discussion about the risk of the actual induction, and it's just so important to consider both sides, the risks of both sides, and not just be one-sided bias towards the side that you want to choose, or you, like even you as your individual. So if you're feeling a bit ick about vaccines but you really don't know why, it's important for you to pick up your bias and look at it properly. Same as, say doctors who are feeling ick towards not having an induction. It's important to look at the bias and really consider both sides.
Absolutely.
And then making your own value-based decision from there.
Yeah.
Wonderful. Well, ladies, thank you so much for jumping on the podcast. Do you want to tell the peeps if they want to come see you, how they can find you and book with you guys?
So probably the best way is just to jump on Coastlife Families website, or our Instagram, or our Facebook. The contact details are on there. We get. I got an email the other day saying I've got to have some breast surgery. I'm worried. Whatever way you guys get to us, we will make an appointment.
Absolutely. And this is for anything as standard as feeding and development. No, sorry, what was the other? What did you say? Development and growth checks. To anything as weird as like you just don't know what the heck to do.
Absolutely.
Reach out, because you guys are a wealth of knowledge, and if you don't know the answers, you will be able to point them in the right direction of who does. So
I don't know what to have to do with the baby, and I don't know what to do with how I'm feeling.
Absolutely. Yeah. 100% agree. 100% agree. Thanks so much for jumping on.
Thanks for
No
having us.
worries. No worries. Oh, we got mamas on. Does anyone have any questions? Feel free to pop it in now. We will wait just a couple of minutes, or probably a minute, because we're going to go to dinner soon. I booked us at Boca, by the way. Are we keen?
Yes.
I said that's where we have to go.
Yes.
Yeah.
Oh my gosh.
But we have small children, so we're used to eating like now.
Well, I made a booking for 6, so
Amazing.
it's 10 to 6. Perfect timing. Perfect timing.
Yeah. Absolutely. My kids
Oh.
are in the shower by now.
I love that I'm giving you guys a nice night out. How fun.
No.
Amazing. Oh, well, thank you so much, guys. Ooh.